1 in 6 Americans will have a stroke during their lifetime, so it's very likely that somebody will be affected directly by this in this community, whether it's themselves having the stroke or an immediate loved one.
They told me, this is just bad. I have to tell you right now, there's a 99% chance you won't make it out of surgery. To wake up one morning and just 2 hours later be told that was traumatic, and to have your kids next to you and just say, come kiss your mom goodbye.
Time is of the essence when someone's having a stroke. During a stroke, we're losing 1.9 million brain cells per minute. The moment they hit the hospital doors, they're converged on by our team, and that will include nurses, physicians, technologists who do the imaging, and the patient is evaluated very quickly, rapidly, by the emergency room physician, and they get the neurologist involved very quickly soon after that.
I'm not supposed to be here. So every day is a gift.
Currently, Huntington Hospital is a primary stroke center, which means that we are built and very efficient in taking care of the majority of stroke patients when they walk into a hospital.
I was given a 1% chance of making it. And if Huntington weren't here, they were the ones that took the risk, and they said 1 is better than 0.
A tube is inserted through a blood vessel in the leg and navigated up to the brain, and a blood clot can be removed that way.
Every doctor, every nurse, everything was amazing.
Huntington, I think, has put really their resources in the right places and invested for the future, and we're seeing the seeds of that develop over time. Huntington will go towards becoming a comprehensive stroke center, which is a whole nother level of stroke center. Currently, there are very few comprehensive stroke centers nationwide, but I think Huntington is very well positioned to become the comprehensive stroke center in the San Gabriel Valley.
When you look at somebody and you can, operating at the best that they possibly can for you, I don't know how to give back to that. I don't even know how to say thank you. It's just, I hope that we live lives that will be worthy of what they've given us.
Every minute of delayed care results in worse outcomes for someone. And those outcomes can be devastating. They can be completely independent versus dependent, depending on a few minutes of time.
I couldn't walk Ethan before in the stroller, and now I can.
I'm looking forward to just keep going on those walks with her. I love holding her hand, That's something I always loved, but when you almost lose somebody, you just realize that, I love holding her hand. If I could do that the rest of my life, then, well, that's enough.
On behalf of myself and the entire Stroke Center staff, I really want to thank all the donors for their support of this program.
I don't have anything but words of gratefulness for Huntington, for the support, for the donors. Thank you.
Thank you for everything that you've given, are thinking of giving, and will give, because we're just one of the survivors. Thank you for giving us this chance at life together that we've had these last 5 months, and the next 50 years that we'll be alive together. We are only grateful.